Symptoms and causes of stomach cancer. The scary thing about stomach cancer is how ordinary the early symptoms look. Someone sits in a clinic and says it is probably just gastritis. They blame stress, fast food, maybe that extra coffee on an empty stomach, but the doctor hears their story and feels a quiet alarm inside. Because some stomach cancers whisper for years before they finally shout. So let us talk clearly about those whispers. Which signs deserve real attention, and when should you ask for help? And remember, this is education, not a diagnosis through a screen. First, you need to know what the stomach actually is. Many people point to any abdominal pain and call it stomach pain. Your stomach sits high in the upper middle, slightly to the left. Food travels down your esophagus, reaches the upper stomach, called the fundus. Then, it passes through the body down to the lower portion, called the antrum. Finally, it exits through the pylorus into your small intestine. The stomach is not just a bag holding food. It is a muscular mixer filled with strong acid and digestive enzymes. It breaks proteins apart, grinds food, and turns it into a thick paste. Think of it as a second chewing system before food meets the intestines. Now think about gastritis and reflux. Millions of people live with heartburn, indigestion, and sour taste after meals. Some feel burning in the chest or upper abdomen after certain foods. You can even have inflammation in the stomach lining and feel nothing. That silent inflammation can continue for years without dramatic symptoms. Every time the stomach lining is irritated, your body tries to heal it. Cells are damaged, cells repair, and this cycle keeps repeating. Most of the time, the repair works perfectly. Sometimes over many years, damage and repair go slightly wrong. Cells begin to change appearance under the microscope. They can move from normal to precancerous, and finally, to cancer. Not everyone with gastritis will get cancer, but long-standing inflammation makes the soil more fertile for cancerous growth. That is why chronic digestive symptoms should never just be considered normal aging. Common does not mean harmless. If your stomach is constantly complaining, it is trying to tell you something. You have chronic digestive symptoms that never seem to fully go away. You keep burping after meals day after day. You feel bloated after small portions, even simple foods. You have frequent indigestion or burning that keeps returning. Maybe you are always reaching for antacids or acid-suppressing tablets. These problems can come from many causes, not just cancer. But if they persist, they deserve evaluation, not another over-the-counter pill. Another important sign is difficulty swallowing or painful swallowing. Cancers growing near the junction of the esophagus and stomach can cause problems there. You might feel like food sticks behind the breastbone. You need to drink water to push each bite down. Sometimes there is pain when swallowing, sometimes just a tight, stuck feeling. Long-standing reflux can change the cells lining the lower esophagus. Doctors call this change Barrett's esophagus. Those changed cells have a higher risk of turning cancerous over time. So swallowing problems, especially with reflux history, should never be simply ignored. Everyone has occasional nausea from infections or food poisoning. That usually passes within days, and you feel normal again. Chronic, unexplained nausea is different. You feel queasy most days, even without obvious triggers. You might vomit occasionally or more often without clear reason. Sometimes vomiting happens right after starting to eat. In some cases, a tumor can partially block the outlet of the stomach. Food cannot pass easily, so it comes back up. If nausea and vomiting keep returning for weeks, you need proper investigation. People might say, "Congratulations, you are thinner, what diet are you following?" But you know you did not change your eating or exercise. Your belt suddenly needs a tighter notch. Old clothes hang loosely without effort. When the body is fighting a hidden disease, appetite can fall. Tumors can also change metabolism and increase calorie use. So ongoing weight loss without trying always deserves attention. Bleeding is a very serious sign. Sometimes a stomach tumor breaks the surface and bleeds into the stomach. You might vomit something that looks like coffee grounds or bright red blood. That is an emergency, not something to wait on. Blood drips into the stomach, travels through the intestines, and gets digested. By the time it reaches the toilet, it looks black and tarry. Doctors call this melena. It has a shiny, sticky, bad-smelling appearance. This is different from bright red blood on toilet paper. Black tarry stool suggests bleeding higher up like the stomach. Any episode of vomiting blood or black stools needs urgent medical care. Another subtle sign is early fullness, also called early satiety. You eat just a few bites and feel uncomfortably full. You cannot finish even a small plate that you once handled easily. This can happen when a tumor inside the stomach takes up space. The stomach cannot expand normally because something is occupying the inside. Over time, early fullness can lead to weight loss and fatigue. If you notice this pattern, especially combined with other signs, speak with a doctor. Sometimes, stomach cancer first announces itself through symptoms outside the stomach. Cancer cells can spread to the liver. That can cause pain on the right side, abdominal swelling, or yellow skin. They can spread to the lungs and create cough or shortness of breath. They can reach the brain and cause headaches, confusion, or neurological changes. They can involve the bowel and cause blockages or new severe cramping. So not all late symptoms feel like classic stomach complaints. That is why early attention to smaller digestive changes matters so much. Now let us step back and talk about causes and risks. Long-term gastritis and reflux can increase the risk of stomach cancer. Infection with a bacteria called Helicobacter pylori can inflame the stomach lining. Smoking and heavy alcohol use also damage the stomach and increase risk. Diets high in smoked, pickled, or heavily processed meats contribute additional risk. Family history and certain inherited conditions also matter. Having these risk factors does not guarantee cancer. Many people with cancer had few obvious risks. But if you have several risk factors plus symptoms, you should not delay evaluation. One key tool is endoscopy. During endoscopy, a thin, flexible camera goes through your mouth into the stomach. The doctor can see the lining directly on a screen. They can take tiny tissue samples called biopsies. These biopsies show whether cells are normal, inflamed, precancerous, or cancerous. Sometimes very early cancers are found in people with few or no symptoms. In those cases, treatments can remove only the affected area and cure the disease. The earlier cancer is found, the more options and hope exist. If you recognize some of these symptoms, what should you do next? First, remember that many other conditions mimic stomach cancer symptoms. Ulcers, gastritis, reflux, gallbladder problems, and functional disorders can look similar. So this video cannot tell you what you personally have. What it can do is remind you that persistent symptoms are not normal. If you have ongoing pain, nausea, early fullness, or black stools, seek medical care. Do not rely only on internet searches or home remedies. A doctor can examine you, order tests, and decide whether endoscopy is needed. Let us also talk about prevention and protecting your stomach long term. Treat reflux and gastritis seriously, especially if symptoms appear often. If a doctor prescribes treatment for Helicobacter pylori, complete the full course. Avoid heavy smoking and excessive alcohol, which together greatly increase stomach cancer risk. Limit highly processed, smoked, and heavily salted preserved meats. Focus more on fresh foods, vegetables, fruits, and balanced protein sources. Keep a healthy weight and manage blood sugar because metabolic health supports all organs. Regular checkups can catch early changes before they become dangerous. Having one of these symptoms does not mean you definitely have cancer. Many young people with chronic digestive issues never develop cancer at all. However, ignoring strong or persistent symptoms gives any disease more time to grow. Early gastric cancer can often be treated successfully, sometimes even cured. Late gastric cancer is much harder to manage. So the safest path is reasonable concern, not denial and not panic. Your stomach is a hardworking organ that rarely complains loudly at first. It endures stress, irregular meals, infections, and medications for many years. When it finally sends clear signals, it deserves your attention. You know your body better than anyone. If something feels wrong for weeks or months, listen to that feeling. Talk with a healthcare professional who can evaluate your specific situation. Ask questions, including whether an endoscopy would be appropriate for you. You are not overreacting by wanting answers. You are protecting your future self. Your body is constantly communicating through sensations, patterns, and visible signs. Learning this language is a form of self-respect, not hypochondria. If this video clarified these signs for you, please share it. Someone you love might be quietly ignoring the same symptoms today. Encourage them to seek help, not to prove something is wrong. Your stomach rarely shouts at first. The wise move is listening while it still whispers.